At the outset, we have this session on orientation of the community health officers. So we invited to physically present the state nodal officers or the district nodal officers who are actually undergone the training in various stages in the previously. So as you are aware, actually Ministry of Ayush approved this component of Ayush Health and Wellness Center in the month of March 2020. After the approval, Ministry has conducted the national level TOT program. And in the national level TOT program, we have invited the state master trainers. And the state master trainers have undergone almost 4 to 5 days training program in the national capital. Thereafter, we requested the states to conduct in a cascading manner. And most of the states have conducted the training in 2020. By that time, the COVID and other things came, so that many of the training programs has been on the online mode actually. Somehow, there is a need of reorientation of the community health officers. So this session is not particularly specifically, we are not going to give that kind of what you call very so-called hands-on training, but what we would like to suggest to you and what the state perception on that, how they have strengthened their community health officers and how they are going to deliver various public health programs which is envisaged under the Ayush Health and Wellness Centers. So when we speak about the Ayush Health and Wellness Center, prima facie, this Ayush Health and Wellness Center is having the mandate of the holistic health in the primary healthcare perspective. So for that, actually, we have added certain components like yoga, medicinal plant component, and even the advocacy about the daily regimen, then seasonal regimen, and outreach activities, and even various sectors of the healthcare. For example, whether it is in the adolescent group, in the pediatric group, in the children, the school children, whether it is in the Anganwadi centers. So lot of segmented areas where the Ayush doctors can deliver the various strengths of the Ayush. So in that context, actually, these guidelines have been devised. For that, appropriately, Ministry of Ayush has already provided all the states different supporting manpower, actually, assistance for the different supporting manpower, including the incentives to the ASHAs. Even in the ASHAs who are actually in the health sector, they are the torch bearers in the community interactions. So the same set of ASHAs are supposed to be used by the Ayush Health and Wellness Centers also. Somehow, many states we are observing that there are little bit bottlenecks. So the states can reflect upon that actually, and we can guide you in what manner this ASHA orientation and other things can be happened actually. And the Ministry of Ayush in that context already published the guidelines for ASHA orientation in the context of the Ayush. So I request all the state nodal officers, I request all the state directors who are actually present physically or those who are watching in the online mode actually, to go through all these guidelines. If you are very well versed in these guidelines, then definitely you can have that kind of reflections, and the further reorientation training of the CHOs can be happened in the field. So in that context, actually, we are lucky enough to that we get the advisor, community health, community process and CPHC in National Health System Resource Center, who is actually instrumental in such kind of national level, making of the national level guidelines and orientations. And he has a long stint of experience in public health actually. He was already worked with the various NGOs in the previous his career actually, and he is actually made many partnership with many different organizations. So in the first instance, before going to him actually, we can just get the ideas from the states also, so that he can share his views on the queries or sometimes of questions raised by the states, so that based on that he can make his presentation. So first I will call upon the mission director, Jharkhand, actually, at the Jharkhand state, even though the state has earlierly, in the context of the National Ayush Mission per se, they were not judged as a very best performing state at that time. But now with the new setup, administrative setup, that in the state actually increased vigor is seen in the implementation of the National Ayush Mission. That is what the ministry noted. So I invite the mission director, Jharkhand, to make his views in this regard.
Thank you, sir. Good evening to all of you and respected members on the dais and off the dais. Before presenting, I'll just show a video of approximately 5 minutes to all of you so that you can understand what work we have done in past 2 to 3 years. So kindly play the video. आवाज कर दो. Sound please.
दिनांक 21 जून 2019 को अंतर्राष्ट्रीय योग दिवस के अवसर पर प्रभात माननीय प्रधानमंत्री श्री नरेंद्र मोदी जी की गरिमामयी उपस्थिति में दिनांक 21 जून 2019 को अंतर्राष्ट्रीय योग दिवस के अवसर पर प्रभात तारा मैदान रांची में बृहद रूप से योगाभ्यास कराया गया, जिसमें लगभग 75,000 से भी ज्यादा लोगों ने इस कार्यक्रम में हिस्सा लिया। इसी के परिणाम स्वरूप बदलता आयुष अब बढ़ता आयुष की ओर अग्रसर हो रहा है। झारखंड में वर्तमान में ग्रामीण जनता को सुगमता एवं सुरक्षित औषधियों के साथ साथ योग द्वारा स्वास्थ्य लाभ प्रदान करने हेतु 745 आयुष HWC तथा गुमला, पलामू, बोकारो, देवघर और गोड्डा में 5 10 बेडेड धनवंतरी अस्पताल एवं रांची तथा जमशेदपुर में 2 50 बेडेड आयुष अस्पताल के साथ साथ राज्य योजना से 10 जिलों में पंचकर्म प्रशिक्षण सह सेवा केंद्र खोलने का कार्य आरंभ किया गया है, जिससे किसी भी मरीज को इन केंद्रों पर 12 तरह की सेवाएं मुफ्त दी जा रही हैं, जिसमें आयुर्वेदिक, होम्योपैथी और यूनानी दवाओं से इलाज किया जा रहा है और साथ में योगाभ्यास भी कराया जा रहा है। आयुष निदेशालय का गठन 2006-07 में हुआ, परंतु ये 2020-21 तक सुषुप्ता अवस्था में रहा। 2021-22 और 2022-23 में भारत सरकार द्वारा आयुष निदेशालय को राष्ट्रीय आयुष मिशन के अंतर्गत लगभग 180 करोड़ रुपए की राशि प्राप्त हुई, जिसके तहत 745 आयुष HWC को भारत सरकार द्वारा स्वीकृत किया गया और उसी कड़ी में आयुष HWC के लिए संविदा पर 550 नए CHO को नियुक्ति पत्र माननीय मुख्यमंत्री श्री हेमंत सोरेन जी के करकमलों द्वारा दिया गया।
आज आपको नियुक्ति पत्र देने के साथ साथ अपने राज्य की बात करें, जहां 80%, 70% लोग ग्रामीण क्षेत्रों से आते हैं, वो कहीं ना कहीं आज के दिन भी सरकारी व्यवस्था पर विश्वास रखते हैं।
प्रत्येक औषधालय एवं HWC में आने वाले मरीजों के बेहतर इलाज के साथ साथ उनकी बीमारी संबंधी जानकारी का डेली लाइव रिपोर्टिंग दर्शाया जाता है। वेबसाइट में एक आधुनिक फीचर आयुष चैटबॉट भी इंटीग्रेट किया गया है, जिससे कोई भी व्यक्ति अपने जिले के डॉक्टर्स, जिला चिकित्सा पदाधिकारी आदि से आसानी से संपर्क कर सकता है। साथ ही मरीज का लिंग, उम्र, बीमारी एवं उपचार से संबंधित सुझाव वेबसाइट पर लाइव होता है। साथ ही डेली पेशेंट रिपोर्टिंग को टेलीविजन पे लाइव दर्शाया जाता है। न्यू इनोवेटिव योजना के तहत आयुष निदेशालय झारखंड के द्वारा 38,400 आंगनबाड़ी में बच्चों के आम बीमारियों के स्वास्थ्य लाभ हेतु आंगनबाड़ी होम्योपैथी किट, जिसमें 9 प्रकार की होम्योपैथी की दवाइयां बच्चों को सर्दी, खांसी, दस्त, बुखार आदि से बचाव हेतु उपलब्ध कराने की योजना के तहत पायलट प्रोजेक्ट में 1000 आंगनबाड़ी केंद्रों को किट उपलब्ध कराया गया है। 62,50,000 स्थानीय गरीब राशन कार्ड धारी परिवारों के लिए 10 प्रकार की होम्योपैथी दवाओं का बिरसा होम्योपैथी आयुष किट के वितरण की योजना के तहत राज्य के 5 जिलों में 25,000 पीडीएस की दुकानों के माध्यम से उपलब्ध कराने का कार्य किया जा रहा है। इसी कड़ी में राज्य में दीनदयाल ग्राम स्वावलंबन योजना के तहत 45 ग्रामों में आयुष कैंप का आयोजन दिनांक 15 मई 2023 से आरंभ किया गया, जो प्रति माह होगी। 745 आयुष HWC से जुड़े CHO, ANM और आशा वर्कर को आयुष से घरेलू उपचार, योग एवं वेलनेस हेतु योग का मास्टर ट्रेनर की ट्रेनिंग पूरा किया गया है। वर्तमान में CHO प्रत्येक शनिवार को वयोवृद्धों के इलाज के लिए घर घर जाते हैं। साथ ही साथ प्रत्येक तीसरे शनिवार को HWC के एरिया में कैंप भी लगाया जाता है। आवश्यकता पड़ने पर ई-संजीवनी हब एंड स्पोक मॉडल के माध्यम से बेहतर इलाज दिया जाता है। योगा में 12 NGO को योग प्रशिक्षण के लिए एम्पैनल्ड किया गया है और 15,430 स्कूलों में कक्षा 6 से 12 में योगाभ्यास हेतु 30,000 से अधिक स्कूल हेल्थ एम्बेसडर को प्रशिक्षण देकर स्कूली बच्चों का साप्ताहिक योगाभ्यास किया जा रहा है। सभी संचालित HWC में 2 योग प्रशिक्षकों को प्रतिनियुक्त किया गया है, जिसमें एक महिला और एक पुरुष होंगे, जिन्हें 20 योग सेशन प्रति माह HWC में कराना है। प्रतिदिन लगभग 4,000 लोग हर जिलों के योग केंद्रों में आकर योगाभ्यास कर रहे हैं, जिनके ट्रैकिंग के लिए योगा ऐप विकसित किया गया है। आयुष झारखंड ने राज्य के प्रत्येक व्यक्ति तक अत्याधुनिक स्वास्थ्य सुविधाएं पहुंचाने की तरफ एक मजबूत कदम बढ़ाया है।
So, thank you for patient watching presentation. So I think all the points which are there in my presentation have already come. However, since I have prepared a presentation, I'll just sum it up in 5 minutes, please. Next slide. Next. This is just to showcase how we started 3 years back. We were not able to spend the budget, and I remember in few VCs when I joined as nodal officer Ayush in the state, I used to say to Joint Secretary ma'am that, ma'am, I am committing that we will do something, but I had my own doubts whether how we will be able to perform, because we had not performed from 2006 to 2018-19. Howsoever, if you see, in 21-22 our budget was 22 crore, 22-23 it became 129 crore, and this year it became approximately 300 crore rupees. So every year, thanks to the Department of Ayush, Government of India, and I'll also give special thanks to our Government of Jharkhand and our ACA sir, although sir is not here. He has given special emphasis for this, and in most of the meetings he has said, if Government of India is not approving, I will approve. So don't wait for them. So that is how we did. And if you see the recruitment of CHO, we did not had, in fact from past 20 years, not even a single Ayush doctor had joined our system. So in last 2 years, we have taken almost 750 doctors. That is 208 doctors in first year and followed by 297. The simple formula which I adopted for selection of these doctors was that we will not conduct any exam. We will just segregate, prepare a merit list based on the marks which they have scored in their BSc, class 12th, BSc and BMS. And if they have done any post-graduation, extra marks will be given to them. So whatever recruitment process which we used to do, and I am sure in many states it is happening that after recruitment people will go to court and all. So by this formula we did not conduct any interview, nothing, and within a period of 45 days my first 208 candidates joined us. The moment we realized that it has a potential, we went for another 297, and now we are in fact for one thing which I'll say for us, since I'm having the charge of MD NHM also and ED Ayushman also. So whatever inter-se learning which I am having in NHM or in Ayushman, we were incorporating it in this, and it was the effort of my team that we could achieve this. So presently I have 580 health and wellness centers which are functional. Next slide. These are the three initiatives which we have to show today. That is IT intervention which we have done. So most of the things have already come in the slide. Another is herbal garden, and then how we have prioritized Ayush services. Next slide. These are our 4 pillars on which when I started working, I said okay, we should have certain pillars of work on which whole team will work, because it is very difficult to motivate. One thing because most of us who are in this department and we are talking about Ayush. Sir, last year I attended a conference in Kevadia, Gujarat. So वहाँ पे sir, that is from Department of Health and Family Welfare. So people, there are so many doctors were there. I am also an MBBS doctor. So they were all talking about mixopathy. They said okay, it should not happen that by promoting Ayush, we end up doing mixopathy to all of us. And because it takes time to do research and analysis, so especially those doctors like doctors from AIMS and PGI Chandigarh, they were very skeptical. Why are we working on it? If it is a lifestyle, so let us keep it to lifestyle. I realize what they are saying is also true. So what we thought the best way, if anybody comes to me, because even if he is a Ayush doctor, he is a doctor. If anybody comes to him and he does not have the medicine, so we said, okay, now I will integrate you with eSanjeevani portal, wherein you can talk to directly link to the allopathic doctor, and if any medicine is needed, just help them out. So instead of saying it is Ayush doctor who is prescribing the allopathic medicine, it is basically through the use of IT technology and tools. My Ayush doctors are helping. If anyone wants whatever type of treatment they want, we are doing it. In fact, further I'll show you how we have identified through the help of our Ayush doctors how many TB patients are there in those areas. So these were our 4 pillars. First is health and wellness center. Second is citizen. Third most important thing was medicine. Even till today, we are fighting how to procure medicine because there are certain rules and regulations regarding purchase. However, during COVID times and with the help of few of our local doctors, we identified few medicines which are needed, and we went for small tender, and we purchased more than 1 lakh kits. So we have, the medicine is the main backbone, because after having inducted CHOs to the team, I realized of 500, 300 of them were from homeopathic stream. So they said, कि sir, आप दवाई जो दे रहे हो, that is not from homeopathic. हमें homeopathic की दवाई चाहिए. Few from Unani and few from Ayurveda. So everybody, since although they are CHO, but they were also having something they have done BUMS or BMS. So we need to understand and appreciate that they want their tradition of medicine should also spread. So we said, okay, we will start procuring your medicine. Howsoever, the EDL which has been given to us by Government of India, as well as for Family Welfare Department. So we are keeping all the 102 medicines in all our health and wellness centers. But for them, those who are having Unani degree, dedicatedly in those clinics we are sending Unani medicine. Similar way, Ayurvedic and homeopathic we are doing. Next slide. This was the real time patient count display on website we started doing. Since I am also heading charge of ABDM, so I said, if anyone comes to me, I want to have his ABHA number. So how it is possible? So even if he is coming for yoga session, uska ABHA card banaiye. So now my yoga teacher, although we are giving him 100 rupees or 150 or 200, whatever, so I told them, let us train all our yoga teachers also to create ABHAs, because at the end of the day, what I realized, Ayush and health both are same, and if we are delivering services to people, then it should be in the mode of Jan Andolan, as well as we should understand that people are really using it or not. So what we did, we said, you start making ABHA for each and every patient, and in fact, ABHA will be, presently it has not happened, but in future, ABHA is going to be the central point wherein we are even planning that whatever data we collect of the patient, that goes into the account, ABHA account of the individual patient by following all the consent processes. Next. These were like, if you can see the district-wise data we started preparing, in which hospital, how many patients have come, that real-time data we started getting. So although all my CHOs are new, but still if we come to know that only 5 patients have come, then from my call center, now we are using, that is what I started with, we are coordinating with other department. So I send my team to 104, from there they call all the CHOs, yaar, aaj to tumhare yahan 5 ही patient hai. तो तुम्हारा क्या ट्रांसफर कर दें, हटा दें, 15,000 रुपए नहीं देंगे, we will not give you 15,000. So now onus is on them कि they should call the patient. फिर what then we said कि if patient are not coming to you, now you should go to patient. So now we also started Ayush Aapke Dwar program, and you saw that especially in NHM, we have a plan for national program for elderly. So every third Saturday, we said that we will have a Vayovrad clinics for them. So every Saturday, every third Saturday, now it is the duty of CHO to roam around the village, which has been assigned to him, and call all the people who are above 60, so that at least those people who are above 60, they get something. And with limited knowledge of the medical system of Ayush, I said कि अगर आप लोग उनको immunity boosters भी देंगे 60 plus वालों को, you are not going to lose anything. At least they'll become your permanent member who will come to your clinic for yoga, and it is a holistic approach. So it started functioning. Next slide. This was Ayush chatbot. So this is just for young people who just wanted to see the slide. So in this chatbot, what we have done, if you type hi, you will get the name of 24 districts. So the moment, let us say first district is Ranchi. If you type one Ranchi, you will get to know how many, which all places are there in that Ranchi district, how many HWCs are there. So if you press any, let us say number 1, so you will come to know what is the name of the doctor there, phone number of the doctor. So everything is available on this chatbot. Next. Similarly, all the applications, this is nothing new from, we have just copied from other departments and we have incorporated in this. Next slide. Next slide. Next. This was important, which we started, that is, this is augmented reality thing, wherein the app is created in such a way that if you make a posture, app will tell you whether your posture is right or wrong. Can we show it now? दिखा सकते हैं? So if, because what I found, the youth, even if they are not doing yoga, if they come to know कि सूर्य नमस्कार के pose इस तरीके से करते हो, the moment pose goes wrong, the app will say that this pose is not right. So वो that we have prepared. Next slide. Next. This is a futuristic goal which I just now said. Now we are even going for mapping district-wise and in fact health and wellness center-wise, what is the prevalence of a disease in that health and wellness center area. For example, I have also incorporated NCD program of Health Mission that, okay, all the CHO please take the blood test of all the patients who are coming. So we come to know how many people in that area with diabetes, how many with hypertension. So it's a holistic plan. I am doing the same in my NHM, with my NHM CHOs, but for them also, what has happened now, we have come to know, like we had recently a measles outbreak over there. So they said, sir, something is there, we don't know what it is. So we sent our team and we came to know, okay, there is some outbreak which मतलब हो सकता है कि after 10 deaths we would have come to know, but it was like a preventive thing. We came to know. We also realized that the vaccination which was done on paper was really actually not done. So we sent our team to do the vaccination. So basically it acted as a monitoring mechanism also. Next slide. Abha card I already said. Next. Next. This is just example like which all diseases we are finding, like diarrhea, anemia, malaria. These things are there in that area. So that is just the thing. Next. Next. These two are our model designs prepared by our ACS sir. I think JS sir knows our sir has got a good acumen of preparing the design. So both the designs, if this is to Yoga Kendra, we have in fact planned that yoga tourism to start in our state. So we have two places. Netarhat and Chaibasa, where we are planning when people come for a tourist visit. So there in our like ITDC, we have our JTDC guest houses. There we'll have these sessions, Panchkarma sessions. So people will have both the benefits of using yoga as well as, and this is the state-of-art building which we are planning to build. Next. These are the few achievements. And apart from all this, we are also in the next phase, since I am heading Ayushman and wherein ED Ayushman have been given the power to create the special packages. So for Ayush therapy, it has not been started across the India, how to incorporate that in Ayushman. So we are in the phase, we are preparing the, I'll say, charts of the cost, how much amount will be needed. From our state, we have prepared a rate chart of all the like therapies which we can do through that. So now what I am planning, we are planning is that we will include those special rates in the Ayushman so that the moment demand will rise, it will create a self-sustainable system for my Ayush hospitals also. So that is how we can integrate different departments so that to further the work which we want to do. Apart from this, we are also in touch with the NCC cadets, wherein we are trying to teach all the cadets the yoga course. We have State Yoga Center in Ranchi, and we have planned that all the NCC cadets, they should have at least 7 days yoga training, and we'll give them the certificate. So that by within next 2 to 3 years, we have a huge human resource with us who knows at least the basics of yoga. And apart from it, we have also started dedicated IC strategy in our state, wherein we have tried to rope in the social media influencers. I am sure you would have seen TikTok videos and YouTube videos. So those in our state, let us say a backward area of Simdega, but there is one YouTube social media influencer having 1 lakh people followers. So we said, I'll give you your 5,000 rupees, don't worry. Aap hamara bhi add kariye. So these type of people we have started identifying, and that's it from my side. Thank you all.
That was a good insight as far as the state of Jharkhand is concerned, particularly how the human resource, particularly the CHOs, the management of the CHOs, how they have recruited in a very seamless manner the CHOs and their CHOs, how they are inducting the CHOs for various public health activities within the existing infrastructure itself, how efficiently the HR can be managed. That itself is one of the takeaway for the other states also to think about that actually. So going from that, now I invite Sri J. Manjunath, Commissioner cum Secretary, Karnataka State, to have the insights about Ayush health and wellness.
Namaskara, good afternoon all of you. Greetings from the state of Karnataka. I have a small presentation. There's a first slide. You can see the wonderful Mysore Palace. The state of Karnataka gets its name from the state of Mysore. The significance of this slide is that last year, on June 21st, the Honorable Prime Minister did yoga here along with all fellow Kannadigas. So we didn't stop at that. Honorable Prime Minister on that day said, you need to attempt something more. What we did, January 15 this year, we attempted a Guinness record for the maximum number of people doing yoga at a time, and we targeted about 5 lakh people across 38 locations in Karnataka, and we managed to do about 4 lakh plus people between 8 and 8:45 a.m. on January 15th. Significance of that day was when the sun moves from the southern hemisphere to the northern hemisphere. We, Karnataka, on the instructions of the Honorable Prime Minister, have attempted and got ourselves a Guinness record on the maximum number of people doing yoga on a particular time. So my presentation begins with this. Basically, we have been asked to speak on what are the best practices we are doing, especially on the Health and Wellness Center. The reason being that Karnataka so far has done about 376 health and wellness center functional. The target given by Government of India was quite less. It was about 276. And about 6 months ago, considering the pace at which we were doing, Government of India said, you can take up 100 more, and then we have now delivered. So what is it that we did to ensure that all this 376 health wellness center becomes functional in Karnataka? I'll take you through a small presentation. First is careful selection of the Ayush Health and Wellness Care Center. So we didn't try to attempt something new, try and build new buildings, etc. We selected a functional dispensary which already had an Ayush physician. We ensured that there was a one building which was there. Also, whatever location that we had identified had to have space for conducting yoga session, also space to raise herbal garden and demonstrate, and also we carefully choose the panchayat headquarters dispensary so that there is more access to lot many people, and then also the footfalls will be quite high. Also the local other health facilities were all roped in for institutional support, for training and referrals, etc. And there are various systems of medicine within Ayush, and then depending on which system of medicine is popular in a particular area, we basically use that to see that the healthcare wellness centers are functional. Basically, these are the elements which are there: infrastructure development, equipment, furniture, HR, trainings and discussion, IEC, yoga demonstration, effective use of herbal garden, practicing panchakarma, documentation, monitoring and evaluation. I'll take few minutes to take you through each one of them. First is the infrastructure development. As I said, there was a careful selection, and then we also ensured that this 376 health wellness centers are spread across the urban and rural area, across the length and breadth of the state. So since the dispensary is the first point of community, we also ensured that there's a medical officer and attender. In Karnataka, there are about 662 standalone Ayush dispensaries. Along with that, urban and rural, we have so far operationalized about 376 dispensaries. As you can see from this map, we have about 31 districts in the state, and you can see that it is well spread out across the entire state, both in the urban and rural area. And even within that, there's a spread of Ayurveda, Unani, and homeopathy wellness centers. Along with that, we have provided various equipment and furniture. There's a projector with mic, TV, CCTV, etc., so that people get to know the various other health services that we are delivering, and also effective communication. The human resources, yes, with the dispensaries have an Ayush, full-time Ayush medical officer. 2 yoga instructors have been provided, 1 male and 1 female. The 2 yoga sessions are conducted, one in the morning and once in the evening. There will be a maximum of 5 volunteers. Some may be ashas or others in each of the linked to each of the center. There's a group D person and a person to keep the premises clean. So the pictures, some of them which you are seeing, are the functional healthcare centers which are there. Apart from that, we have undertaken massive training program. All the CHOs, 376 CHOs have been trained. Yoga instructors, 186 of them. There are the remaining yoga instructors who will also be trained. As you know, Karnataka had elections for the last 2 months, because of which some more people have to be trained, which are taking it now. And ASHA and other volunteers, about 322 of them we have trained so far. The next thing is IEC. Many IEC activities have been undertaken, especially to inculcate the sense of well-being, lifestyle, all that among school children, college students, school teachers, ASHA workers, the municipal employees, the Poro Karmikas, self-help groups, etc. We conducted what is called a National Nutritional Week on the first week of September. Also, various melas are being conducted. Then we have special campaigns for the diabetes mellitus and hypertension, the non-communicable diseases. Also on lifestyle disorders management camps. So also various camps we try to distribute medicinal plants so that people can grow them in their backyard and also know of their importance. The next slide is on the yoga demonstration. Every health wellness center, there's a yoga which is happening every day, morning and evening. There's a female instructor as well as a male instructor. The timings are slightly flexible in the sense that locals also decide what time they start, what time they end. Also, certain t-shirts are provided so that there's some kind of a equality among all of them. As we said, the last 1 year we have done 2 major events, one with the Honorable Prime Minister in Mysore, and another is the Guinness record, which we successfully did in 15th of January. This is the slide from the Yogathon, which was done. The Honorable Governor of Karnataka himself came and participated to motivate all the people who would practice yoga. So the next. Herbal garden, there were many medicinal plants which are being grown. Some are listed here. On average, about 50 varieties of medicinal plants are being grown, and brochures on various the medicinal plants are being distributed, all in the regional language. Apart from the health and wellness center, the school grounds and other government places, especially from the revenue department, large tracts of land which are available are being made use of to grow medicinal plants. Apart from that, we also have a scheme in Karnataka where we incentivize farmers who go in for growing medicinal plantation. These are various other treatments which we have been providing at the health wellness centers, Panchakarma and cupping therapy from the Unani system of medicine. The documentation part, there's a OPD register, there's a patient slip, there's a stock register, cash book, the bill register, the visitor register, and the acquittance register. We also have Karnataka is an IT capital, Bangalore is an IT capital. We have this GIS Ayush, which has this GIS asset for people to see where a wellness center is, etc., and then get a lot more information. So basically, these are the documentation which are there, Health and Wellness Center. Robust monitoring and evaluation mechanism is also put in place. There are a whole lot of visits by various people, including me and our officers. There's a nodal officer for each district who goes around and sees whether all the original objectives with which we started the health and wellness centers are being met. In fact, the Honorable Minister of State, Shri Mahendra Sir, was in Karnataka yesterday in Hubli, Dharwad, and he made it a point to visit 2 of our health and wellness center. We call them Kshema centers in the local language. So we were privileged that he visited a few centers yesterday. So the whole lot of periodic visits, this is a pic from yesterday where he visited a few centers. As you can see from this slide, between the 2021, 22, 23, the graph is growing exponentially. This is the number of beneficiaries who have utilized OPD services in our healthcare centers. Karnataka, the Ayush, all these numbers are basically people going to the public health facility. Karnataka, the private sector is in Ayush has outgrown the government sector basically. Those numbers are not here. This about 5 million people have availed Ayush services in the state of Karnataka in the public sector in the last 1 year.
And this is about 1 million people in the health and wellness centers alone. The right side you can see, the previous slide, the right side you can see the non-communicable diseases, the diabetes and hypertension, the screening and the follow-up numbers which have been going up each year. The next thing is yoga, number of yoga sessions which we have conducted. It has been growing. There has been 25 to 50% growth year on year. About 166,000 beneficiaries have availed in the last 1 year, leaving apart all this International Yoga Day, the Guinness Record Day, which we did, all that. It is on a daily basis, number of people who have been using yoga in the healthcare facility. There are various surveys that we have undertaken through door-to-door survey, the ASHAs, etc., the population enumeration survey, the community-based assessment survey, the Prakriti analysis, lifestyle assessment. These are picks from some of the surveys which are being done to educate people. And the last few are the number of slides, the pictures of some of our health and wellness centers which have been done. The various, also we facilitate people participation, the students participation in various yogasana competitions wherever they would love to go. And thank you. This is Hampi, the Vijayanagara Empire. We started with Mysore, the ending with Hampi. So basically to say that we have broad-based yoga and the sense of well-being amongst the people. So this is all my presentation. I will end with a small video of about 3-4 minutes. This is not from an urban center, not from a tier 2 city, this is from a remote village in Karnataka. I hope you will like it and enjoy it. Can you play the video? This is Kempasiddana Hundi, from where our new chief minister will be basically somewhere near Nanjangud Taluk.
Wherever you set your eyes on, mostly farmers, the villagers depend on agriculture and their own labor for their lives. The daily life of villagers embodies the spirit of Negila Yogi, the way renowned Kannada poet Kuvempu described farmers. Apart from doing hard labor on the field, they have become role models to everyone by setting some time apart every day for physical activity and health. After the government Ayush dispensary in the village was upgraded to Ayush Health and Wellness Center under the Narendra Modi ji-led Union government's ambitious Ayushman Bharat scheme, the villagers here have become real yogis by adapting the schemes in their daily life. This small village, Kempasiddana Hundi, near Nanjangud in Mysore district, the culture capital of Karnataka, has now attracted the attention of the country.
ಈ ಊರಿನ ಎಲ್ಲ ಗಣ್ಯರು ಇದಕ್ಕೆ ಈ ಒಂದು ಕ್ಷೇಮ ಕೇಂದ್ರದ ಅಭಿವೃದ್ಧಿಗೆ ಅಥವಾ ಇನ್ನು ಒಂದು ಈ ರೀತಿಯ ಮೇಲ್ಮಟ್ಟಕ್ಕೆ ಹೋಗಲಿಕ್ಕೆ ಎಲ್ಲರೂ ಕಾರಣರಾಗಿದ್ದಾರೆ.
In this village, with a population around 600, people have adapted a healthy lifestyle by incorporating yoga, pranayama and meditation into their daily routine. By taking full advantage of the government scheme Ayushman Bharat and adapting yoga, they have become role models for the state and the entire country. Men, women and children here practice yoga every day under the guidance of a qualified yoga instructor.
ಯೋಗದಲ್ಲಿ ಅವಕಾಶವಿದೆ ಅದನ್ನೆಲ್ಲ ಅವರಿಗೆ ಹೇಳ್ಕೊಡ್ತಾ ಅವ್ರ ಆಮೇಲೆ ಒಂದು ಸ್ಟೇಜಿಗೆ ಬಂದ್ವಿ. ಸ್ಟೇಜ್ ಇಂದ ಇವಾಗ ಅಣ್ಣಂದಿರ ಜೊತೆಯಲ್ಲಿ ಕಾಂಬಿನೇಷನ್ ಆಗಿ ಮಾಡ್ಲಿಕ್ಕೂ ಕೂಡ ಅವರು ಸಂಕೋಚ ಪಡ್ತಾ ಇದ್ರು. ಇವತ್ತು 12 ಜನ ಇದ್ದಿದ್ದು 18 ಆಯ್ತು ಒಂದು 6 ತಿಂಗಳಲ್ಲಿ. ನಂತರ ಅದು ಒಂದು 60ರಿಂದ 70-80 ಜನಕ್ಕೆ ಬಂತು. ಸೊ ಈ ಊರಿನ ಗ್ರಾಮಸ್ಥರು ಕೂಡ ತುಂಬಾ ಚೆನ್ನಾಗಿ ಸಪೋರ್ಟ್ ಮಾಡ್ತಾರೆ, ಯೋಗ ಬಂಧುಗಳು ಕೂಡ ಅಷ್ಟೇ.
At Dwan, hundreds of people start gathering in lush green fields on the village's outskirts. The expertise they have gained in yoga, doing various asanas irrespective of their age, is an inspiration to people who suffer from various health issues due to the stressful life in the cities.
ಆಸನಗಳ ಬಗ್ಗೆ ಸಲಹೆ ಕೊಟ್ಟು ಯಾವ ಆಸನ ಮಾಡಿದ್ರೆ ಆರೋಗ್ಯಕ್ಕೆ ಒಳ್ಳೆಯದಾಗುತ್ತೆ ಅಂತ ಎಲ್ಲ ಆಸನಗಳೆಲ್ಲ ಹೇಳಿ ಹೆಂಗಸರಿಗೆ ಉಪಯೋಗ ಆಗುವಂತ ಆರೋಗ್ಯದಿಂದ ಹೇಳ್ಕೊಡ್ತಾ ಇದ್ದಾರೆ. ಮೆಟ್ಲತ್ತಿದ್ರೆ ಎದುರು ಬರ್ತಾ ಇತ್ತು, 3 ಸಾರಿ ಉಸಿರಾಡಬೇಕು ಆ ಥರ ಆಗ್ತಾ ಇತ್ತು. ಇವಾಗ ಎಲ್ಲ ಕಮ್ಮಿ ಆಗಿದೆ. ನಮ್ಮ ಆರೋಗ್ಯ ನಮ್ಮ ಕೈಯಲ್ಲಿ ಅಂತ ಬೆಳಗ್ಗೆನೆ ಬೇಗ ಎದ್ದು ಬಂದು ಇಲ್ಲಿ ಯೋಗ ತರಬೇತಿ ಮಾಡ್ತಾ ಇದೀವಿ.
Is an inspiration to people who suffer from various health issues due to the stressful life in the cities. Not just this, Ayush Health and Wellness Center has been working hard to create awareness and help people adapt Ayush treatment, good diet and healthy lifestyle adaptation strategies.
ಹಳ್ಳಿಯವರು ಸುಮ್ಮನೆ ಬಂದ್ಬಿಡಲ್ಲ, ಅವ್ರಿಗೆ ಏನಾದ್ರೂ ಒಂದು ರಿಸಲ್ಟ್ಸ್ ಇದ್ರೆ ಮಾತ್ರ ಅದರದ್ದು ಅನುಭವನ ಪಡ್ಕೊಳ್ತಾರೆ. ಹಿಂಗೆ ಯೋಗಾಗೆ ಬಂದ ಸ್ವಲ್ಪ ಮಹಿಳೆಯರು ಏನ್ ಮಾಡ್ತಿದ್ರು, ಊರ್ ಒಳಗಡೆ ಹೋಗಿ ಅಕ್ಕಪಕ್ಕದವ್ರಿಗೆ ನಾವ್ ಹಿಂಗ್ ಯೋಗಕ್ಕೆ ಹೋಗ್ತಾ ಇದೀವಿ, ನಮ್ಗೆ ಹಿಂಗ್ ಅನುಕೂಲ ಆಗಿದೆ, ನೀವು ಹೋಗಿ ಅಂತ ಹೇಳ್ಬಿಟ್ಟು ಅವ್ರಿಗೆ ಒಂದು ಎನ್ಕರೇಜ್ ಮಾಡಿದಾಗ ಬೇರೆ ಹೆಂಗಸರು ಸಹ ಬರಕ್ಕೆ ಶುರು ಮಾಡಿದ್ರು. ಹೀಗೆ ಬರ್ತಾ ಬರ್ತಾ 15-20 ಇದ್ದಿದ್ದು 30 ಆಯ್ತು, 40 ಆಯ್ತು. ಒಂದ್ ಹಂತದಲ್ಲಿ 90ರಿಂದ 100 ಜನ ಮಹಿಳೆಯರು ಒಂದು ಚೂರುನೂ ಸಹ ಕಷ್ಟ ಇಲ್ಲದೆ ತುಂಬಾ ಖುಷಿಯಾಗಿ ಯೋಗಕ್ಕೆ ಬರೋರು.
Despite doing hard physical labor in fields every day, it is appreciable that the villagers have taken to yoga over and above that for good health. It is something that others need to follow too. Yoga karmasu kausalyam goes the Sanskrit saying, which means regular practice of yoga enriches the work a person does even further. Yoga is a great tool to attain better physical and mental health. Under the central government sponsored National Ayush Mission (NAM), the Ministry of Ayush has decided to develop 12,500 Ayush health and wellness centers across the country. Accordingly, Ayush Department, Government of Karnataka has till date developed 376 Ayush health and wellness centers. The main objectives of Ayush health and wellness centers are to create awareness about holistic healthcare, home remedies, Ayurvedic system of medicine, to introduce and distribute medicinal plants, to conduct Ayush health inspection camps and teach yoga. The Ayush department hopes that members of the public visit Ayush health and wellness centers across the state, take full advantage of the facilities available there and maintain good health. Sarve bhavantu sukhinah, sarve santu niramayah.
So, what you saw was basically from the public health facility. We also have a robust private sector for which we facilitate. The Delhi Chief Minister happened to come to Karnataka and avail of a facility in Bangalore to meet his health requirement. Also the UP Chief Minister, UP Ayush Minister, Dayashankar Sharma, who was here today morning, you might have heard him, he mentioned that he along with a team of UP senior officers, the Additional Chief Secretary of the Uttar Pradesh government, and along with officers had come to Bangalore to see the state-of-the-art wellness centers which are there in the private sector, the Jindal Naturopathy, the Dharmasthala SDM College, Naturopathy, yes, Vyasa Institute, all that. And to tell you, if you have to get into the Jindal Naturopathy, you need to book 3 months in advance. That is the kind of awareness which have gone in, and I would urge people from all across India, please do come down, see and the things that we have done in Karnataka and in the field of Ayush and the facilities which are there. Thank you very much.
Thank you, sir. So that was the state from Karnataka. So they have shown that how the pace of operationalization of the Ayush HWCs, that is why they got additional 100 more HWCs, and accordingly how they are envisaging various public health programs, particularly the focus is on yoga. And now I invite Madam Sonali Pongshe Vengankar, Commissioner Secretary Ayush Madhya Pradesh, to have the views of the states on HWCs.
धन्यवाद रघु जी। सभी को नमस्कार। यहाँ पर उपस्थित जॉइंट सेक्रेटरी मैडम, स्टेट के सीनियर अधिकारी, यहाँ पर मंचासीन सभी स्पीकर्स और यहाँ पर सभी राज्यों से पधारे सभी अतिथिगण, सभी को ये बताना चाहूँगी कि आज जो मध्य प्रदेश का HWC के बारे में बताने का मुझे मौका मिला है, इसलिए बहुत बहुत धन्यवाद देती हूँ गवर्नमेंट ऑफ इंडिया आयुष विभाग को। Actually, since it is very risky to be a last speaker, because already whatever was to be told is already covered, so, and both of them had the privilege of hosting Yoga Day, so they could start with it, and and this time we are going to hold International Yoga Day, so maybe in after a couple of months I will be able to show that. So yeah, so we are starting with Madhya Pradesh HWC centers. Yeah, can we have a next slide, please? Yeah, this is already covered because that 12,500. Yeah, objectives also everyone knows, so I'll skip. Yeah, next, please. Yeah, these three main packages that also all the practitioners are knowing Prakriti assessment, assessment, then 12 services, and then medicinal plants. So these are the three main components. Yeah, next, please. Key principles of Ayush HWC. Actually, the focus is on prevention of diseases. That is because we are already working into health sector, and Corona has actually encouraged all Ayush department functionaries to go for prevention, because that time immunity was promoted, immunity was sold also. So focus is on prevention, and focus is on empowering community for self-care, because there is a lot of work going through BCC and IC. Then common home remedies, that is also there. Assessment.
To demonstrate a holistic wellness model and improvement in quality of life. Actually, we are placing emphasis on the wellness aspect of it.
So improvement in quality of life. Yeah, then Ayush HWCs. So this also everyone knows through state, UT government. This is the implementation framework. Ayush, there is Ayush HWC team. Then there are local level facilities. Then there are referral institutions. And then there are a lot of infrastructure developed in Ayush also. They can refer to, like here Government of India is stressing on e-Sanjeevani. In Madhya Pradesh, we have our own app called Ayush Cure app. So we are using our own hospitals as referral institutions. Also, we have MOU with Health and Family Welfare Department. So they are also acting as referral institutions. Then telemedicine I already told, and this centrally sponsored scheme, NAM is overarching everything. Yeah, next please. So the Ayush HWC in Madhya Pradesh is basically we are upgrading pre-existing Ayush dispensaries. In our state, we have 1,773 dispensaries. So we are taking up some of the dispensaries and upgrading them to HWCs. When we are selecting those, we see that they are not close to available PHCs or CHCs, so that more outreach is there. Then aspirational districts, they are to be given priority. Then we are also consulting health departments so that there is no duplication, because they also have HWCs. Then the cost norms are as approved by Expenditure Finance Committee. Supply of Ayush medicines. NAM has played a big role in supplying medicines all over the Ayush facilities. And like someone mentioned that there is a huge problem in procuring medicines. So in our state also there was a problem in procuring medicines. Actually, there is a cabinet decision whereby we are required to procure medicines through the forest department's unit only. So, but there were some issues with that, like they were slow, and some of the samples they were not passing in our laboratory tests. So last time what I did, I joined just in November. So there was a huge target to be done before March. And all of the money of medicines was actually pending. So I was a bit actually puzzled how to go about it. But IMPCL came to our rescue actually. So we divided our orders equally between forest department's unit and IMPCL. And you won't believe that created wonder actually, because someone was placed against, there was a competition between the two, and both of them fulfilled almost 40 crore of order within 4 months. So that was a huge achievement for us, and our all the units are flush with all the medicines. So I think by that way we could overcome this medicine supply problem. Then MOU on the use of IT platform and data sharing, that I have already told at DOHFW. And now this also, next slide please. Upgradation of Ayush dispensaries. So this also, I think everybody knows that there are some performance-based linkage, there are indicators. So OPD, Prakriti, I think I will skip it, you know it already. Let me come to, next please. Ayush SWC team. This is also standard everywhere. We have actually, I wanted to raise some issue regarding this. We have CHO, then he is supposed to head this HWC, and then he has some paramedical staff. He has yoga, 2 outsourced persons, yoga trainer and yoga assistant. And then there is team of volunteers, ASHA. There is some issue regarding CHOs, that we have some medical officers also there. There is, the norm says that wherever we are having medical officer, we should not place CHO in place. But actually, CHO has to do lot of outreach activities. So then the OPD is actually suffers if CHO goes out for many days. So at some places we have both MOs and CHOs, but we are trying to rationalize their postings. But yeah, this is one issue. And one more issue I have flagged later, that there is so much of turnover in CHOs. Like for us also, about 100 of CHOs of total 376, they have left the job. So there is, I mean, they're coming. Then if someone gets a better job or PG, admission to PG course, then he will leave. So that is one issue, that there is turnover in CHOs. Yeah, next please. Yeah, this reporting system is standard Form 1, which is sent by CHO to the district, and then state compiles in Form 2, and then Form 3 we are sending to National Ayush Cell. Yeah, please, next please. Next slide, please. Yeah, some of the innovative activities are earlier my Honorable Minister also mentioned this Yog Se Nirog. This started when Corona disease was in full swing and the hospitals were full. So some of the affected people were quarantined at home. So while they were recovering, this was Yog Se Nirog was started on online. So people who were isolated, they were in the rooms. They were given this training by a yoga trainer, and they were doing yoga while sitting at home. So it was very helpful for them to recover fast, and also there was some contact with outside world also. Then this Vaidya Aapke Dwar is just now I mentioned Ayush Cure telemedicine app. This was also very helpful in reaching our outreach activities, because everyone who goes to this HWC, so he has access to our Ayush doctor who is placed there. But if we have connected through this app, we have 100 of the doctors who are experts. They are actually the college staff, and they are connected to the people. So we are actually monitoring this downloading activities also. We like whenever to reach out to more and more people, we started conducting mega Ayush camps actually. So otherwise the practice was that the camps were carried out they have some targets. They have to carry out 2 camps at dispensary level, HWC level. So what we started is to hold the camps at district level as well as block levels. So people, there are a large number of people, they started coming, because we have made the services available to their close nearby places. And also what happens is they can connect to the specialist at the HWCs, and also through Melas they can connect to specialists. So their interest also is actually kept up. So this has been very helpful. Yeah, Panchakarma facility. We have actually sorted out some, we have identified some 100 of our facilities, HWCs, where there is some space, and we last year we procured this Panchakarma table and some equipments, and we sent to these 100 HWCs, and some of them have started offering Panchakarma services also. So that is very well appreciated by people, because otherwise for Panchakarma they have to come to 30-bedded hospital or 10-bedded hospital. We don't have 10-bedded hospital, 30-bedded hospital. So now this has actually reached to their to the villages actually. So yeah, next please. Yeah, some of our HWCs, they are also being developed as delivery points. So like the team also visited, Alirajpur district is a tribal district, and remotely there is the HWC which is doing this delivery, which is being developed as delivery point. So so this is also very well appreciated. In fact, also in our hospitals also, whenever I pay visit to them, people, they're finding Ayush facilities more convenient than allopathic facilities. And I asked, why is it so? Why have you come to Ayush hospital for delivery? So the lady said, oh, we have been always coming to Ayush. And here individual attention is given, because the crowd is less actually. So that also lessens the burden on allopathic hospitals. So people are liking these hospitals and facilities for delivery. So yeah, next please. Yeah. Yeah, your answer is here. See, now we have developed Ayush SWCs with residential quarter. So this is innovation in Madhya Pradesh that there is on the ground floor there is HWC and on the first floor the quarter of this one is there, CHO. So this is very well appreciated by all because the CHO is actually, he comes from other place. Other functionaries like compounder and the class 4, they are from the village only, but CHO is not from village. So building the quarter like this has helped a lot. Yeah, next please. Follow, yeah. So there is some, the survey form to be filled up and we are sorting out the patients with chronic diseases, and also the follow-up action is taken because simply doing survey is of no help unless you monitor it and take it further. So that follow-up action is also taken. We want to actually use the what Bhavish has done, the IT application, so that we could digitize all this follow-up action and see for us. So we will be doing in next phase this. Yeah, so these are the field activities. The forms are being filled up and we are going to school also. Then to some yoga activities are taking place. Yeah, next one. So there was some talk about CHO recruitment process as well. So for Madhya Pradesh, what we did is CHO online exam was conducted with the help of MP Online, and most of the headache is to post them to their the place of choice. So how we tackled is we did choice filling, like we are doing counseling for college admissions, no? So we use the same agency, MP Online, and we use them for choice filling of the postings. And we posted the CHOs according to their choice and merit. So many issues were solved. But still, as I mentioned, turnover is there because of better opportunities, but that is all right. So, document, I have mentioned this. Chalo. Next one. Yeah, so then CHO's induction cum orientation training is also carried. There are two types of trainings. The newcomer CHOs are trained. What we did is the trainings were conducted on a divisional basis, division-wise, and they were called to the college because in college we have better infrastructure and also better lecturers and staff available. So in colleges we gave this induction cum orientation trainings, and you can see some training modules in next slide. Yeah, next please. These are some of the material given to them, operational guideline, orientation guideline. This was the training calendar. This is, I'm talking about latest training of the CHO batch where I could also participate. So, yeah, next please. This is reorientation training. So those CHOs who are older in service, who have completed 6 months, they were given reorientation training in RCVP Naronna Academy, which is the ATI of our state. So they were very happy because going to ATI is considered as very prestigious. So the CHOs were very happy. I'm sitting there in their group photo. Because earlier I was director of the academy also, so that made my job very easy. One more thing I forgot to mention is we have signed MOU with Japaigo. So Japaigo, they're an NGO, and they are also working with Government of India and many other state governments. So they were very helpful in chalking out these training modules for the refresher courses. So there are some issues in operationalization of HWCs. There is high turnover of Ayush CHOs. The issues are low salary, not getting desired place of posting, and also getting some more worthier opportunities maybe. Then outreach activities, including surveys, so that makes unavailability of doctor for OPD. So that also issue needs to be flagged. And yeah, ASHA workers, they are a bit slow. I should not say do not cooperate with CHOs. I should tone it down. But yeah, because they are already busy in doing this work of health and family welfare. So some call needs to be taken on that. Yeah, now that is the way forward. So what we are actually looking at, yeah, can you click once more? So that these 1, 2, they become visible. Yeah. So actually recently there was one Chintan Shibir, and we had thought of how to go about for the year 2047. So there we have planned increasing number of HWCs and providing Panchakarma services, so that we make Panchakarma services available near to the villages. Then develop Ayush Gram at all the villages in which HWCs are located. So presently actually MP has got only 75 Ayush Gram, and plus this year we have taken up one Ayush Gram and each district. So that comes to 51 more. But we plan to have more Ayush Grams. Then increase the number of Ayush HWC with residential facilities, because Mr. Mohan Singh rightly pointed out that if you have to give delivery services, then we need to do this also. And then also, yeah. Yeah, that is not then. This is just innovation, and we are starting with it actually. And this is way forward, so we will continue to add to this. Presently only 6 of them are there where delivery points are developed. But see, MP has thought of this, and we are already working on it. So, yeah, next is upgrade all the remaining Ayush dispensaries, because presently we have 1773. In Chintan Shibir, we have already thought of increasing dispensaries also, but presently at least we should be able to upgrade the dispensaries. And then last time in the review meeting, Secretary Sir pointed out that we should go ahead with NABH certification. So we have actually thought of NABH for colleges, the hospitals which are linked to colleges first, because already they are having good infrastructure, and already IPD, OPD both are doing well there. So, but this is a new concept, HWC, we can go ahead with NABH in HWC. And yeah, these are some of the IEC material developed by us. And thank you so much for your patient listening.
Thank you, ma'am. That is an overview of the state of Madhya Pradesh in the Health and Wellness Center specifically. So now, as before closing, yeah. We can do one thing, let the final speaker, let him speak, and then after that we will just show a glimpse actually. So I request Dr. Balasubramaniam, Advisor, Community Process and CPHC, to have his words of wisdom. So.
Good evening, everybody. Distinguished panelists on the dais, the senior officials of the Ayush Ministry, and senior officials from all states, and my dear CHOs too. In fact, my job has become very easy because whatever we are trying to conceptualize, I'm very happy that all the states have started operationalizing it. So in that context, it is very simple to this one say that the concept and the reality seems to be matching. And more important, the concept is emerging from the ground. So in that context, it is much easy. Before I move on to this one, I want to start off with three important elements to refresh our thoughts. First and the foremost thing, I just wanted to inform you is, especially after the discussions that we have had from three of the states and very well performing states and probably a benchmark for other states to emulate, the national health policy has emphatically told about pluralism. There is absolutely nothing that we need to debate upon with respect to whether this has to be there or not to be there and how it has to be there. The second thing is we need to appreciate the fact that our debate cannot be on the health system because health system is only one for a nation. Medical systems can be many, but health system is basically looks at only about half a dozen parameters. What does it look at? How do you service health? That's all. Second, how are you ensuring human resources for health? Third, because health has to be a community process, because it is a community owned, no state and no constitution can simply say that I am responsible for people's health. Because if people don't take care of themselves or people don't collaborate to take care of themselves, there is no way health system can ever do. So community process becomes an extremely important thing. Today's world without technology and considering the diversity and the enormity of the task that ahead, without technology you can't do anything. So healthcare technology becomes another element that we have to look at. And if you want to have a satisfied client, quality becomes an extremely important issue. And of course, to carry out all these elements, you have to have an administration. So for me, health system only means this. So let me not debate about what is Ayurveda, what is yoga, what is Unani. There are experts over there. And Dr. Bhavnish has actually beautifully put it across, saying that let's not be in conflict of law, and let us not be in conflict of competences, let us not be in conflict in terms of eroding quality parameters on the ground. Every practitioner comes with a clear set of competencies, and they are capable of delivering only that competency. So let us fix that. But at the same time, people will have to give choices. Development is all about expanding people's choices. And people should have choices, means wherever I go, whichever is the nearest facility, I should be able to get whatever I desire, not what you're pushing me to access. So that element has to be very clear. So to that extent, whether you have people, whether you use technology, you ensure people have choices to access. And this is the whole concept of a health system here. The second thing that I also want to add, especially after reading the concept note that I received from the Ayush Ministry regarding ASHA, and there was something, but I appreciate Karnataka government's presentation where they've clearly ironed out ASHAs have been there. And I also saw that equally that Jharkhand and Madhya Pradesh also has been able to leverage ASHAs. First and the foremost thing, it's a myth that ASHA is a worker. ASHA is not a worker. Okay, by the cabinet note of 2005, January, ASHA is not a worker. Okay, ASHA is a community health volunteer chosen by the people from their own residents, supported by the people and serving her own people. So there is absolutely no way that's in this one. And the most important dimension she brings in is she is the voice of the community inside the health system. Again, I'm not talking about any medical system. I'm talking about health system, whichever facility there. Because this is a beautiful concept that only India evolved, where She represents the community inside the health system. That is why she can be an activist. That's why the ASHA definition says accredited social health activist. Can you make a government functionary activist? Can I and he become an activist inside the government? Okay, you know what happens. Okay, so if you're recognizing her to be an activist, she actually is not part of the system, but she is an insider from the community to the center. In fact, they have deputed somebody inside for us. And she is the bridge between the health care delivery system and the community. She can tell what happens in the facilities to the community so that all services that are available in the facilities can be known to people. She can bring back people's needs to the facility to say that these are people's aspirations and expectations. Will you be able to deliver or not? This is the second thing that we have to look at. So when we are talking about it, we know what is health system. We also are very clear about pluralism as a choice to the community. And third thing, ASHA says this one. Now I come back, this is all about overall framework of public health. But I also want to come back to our own CHOs, though there are far and few here for them to understand. And of course, many of you are also medical doctors. And irrespective of what system each of you might have graduated, I'm an anesthetist. Dr. Bhavnesh is actually an MBBS doctor. Okay, so I've lived amongst the tribals in Mysore district in Karnataka for more than 3 decades. So I understand what happens at the people level there, and that gives me the, I would say, conviction as well as the experience to share some of my thoughts here. Now when I'm talking about this one, our medicine definition, all of you should understand and appreciate. It has not been this one. We have forgotten our medicine definition. We have all become prescribers of pills and excisers of lumps. And the definition you see that, that's my first slide. So that all of us understand what doctors are expected to be doing. Next slide, please. Yeah. So medicine actually, as this is actually the 16th century. It is not even Sushruta and Charaka's time. I'm talking about as recently as 16th century when Henry Sigarist was a medical historian who wrote this. He says medicine, by providing health and preventing illness, endeavors to keep individuals adjusted to their environment to be useful and contented members of the society. So your end goal is not about bandaging a wound or reducing a fever. Your end goal is to ensure the person gets adjusted to the environment to become useful and contented members of the society. And by restoring, if somebody is not in that track, restoring their health and rehabilitating them to readjust the individuals to the environment so that they come back. In the first component of the sentence came our promotive and preventive medicine. So that if person is already there, he has to be healthy. So, and that is there in your Ayurveda definition also. I'm not very good in Sanskrit, but I also can say that you have swastasya swastya rakshanam. So what does it mean? It is basically if you are healthy, keep them healthy. Okay, that's also a mandate of a doctor. That's also a mandate of a health system. Second, if the person is unwell, then restorative and rehabilitative, and today palliative can be added onto that. And that is the component that this one. But over a period of time, we have only come down to only one restorative, which is equal to curative. Rest of it we have forgotten. So today's health system has to look at 5. Promotive health, prevention of disease, cure of disease, if not cure, early detection and treatment, rehabilitation for the patient, and palliation, because we want them to be useful citizens of the society, functional by themselves. That is what, because even the care is it. So this is something that we have to look at. Second, then if medicine is this, then what is public health? Because I've been asked to orient people about public health. Let me go into the next slide, what public health definition actually means. Winslow recently, as recently as 18th century, he started talking about science and art of preventing disease, prolonging life, and promoting health through the organized efforts and information choices of society, organizations, public and private communities and individuals. It's a very large, this one, in the sense that it virtually includes the whole of society. And what it means, it is preventing disease, prolonging life. So both are there. So public health also has got everything. So public health does not mean only preventive and promotive. It requires everything. So what is the difference between the two? The difference is in your clinic, you are targeting an individual. In your public health, you are targeting the public as a whole. So when I mean public as a whole, I'll explain what it means as a way. So the approach uses organized community efforts. So you cannot sit in the clinic and say that I saw 20 patients. That is not public health. But that doesn't mean those 20 patients that you see in the clinic is not part of public health. Okay? We need to upgrade. It's an organized community event. Only seeing the clinic is not going to help. So that is why public health is an approach and not just a subject. Okay? So how do you go about doing it? Next. So you have to look at these 4 principles. The principles actually looked at only 4 things. First is equity. All these words will be found even in our policy, which is basically equitable. Equitable means it should be available, accessible, affordable for everybody. Second, community participation. Without the community, you can't do anything. Okay? Because there have to be a continuous ownership, because even for utilization of the services, people should have trust in your system. And for them, they need to own it up. Trust comes only when there is ownership. And ownership, in contrast to accountability, comes with emotions, not by law. Okay? So that emotions. Then comes the intersectoral coordination, because if you want to get the whole of society, there has to be coordination between them. You cannot say, I am the health system person, I want to deal only with health. Nutrition is with Women and Child Development Department. You can't forget about them there. Sports and fitness comes under youth supports, this one. You can't forget about them. Lot of it gets rooted when you're as a school child. So if you cannot forget education, because education is molding all our future citizens. So intersectoral coordination. And finally, appropriate technology. And this has been there all along and not just of today's world. Next. So now, how do we actually organize? Now, one of the important elements of public health, when you're looking at a large bouquet of people to be organized and provided on a wholesome platter of their choice to their satisfaction, you need to keep your costs low. You can keep your cost low only when you peg the problem at the root. Okay? The more you allow for it to become severe, your expenses go up. So there is no other choice. Primary health care has to be strengthened. That is why the bottom of the pyramid becomes the most important thing. So the whole pyramid is our health system. And there has to be a clear gateway so that everybody simply not then. For a running nose, you come to medical college because you want to see an ENT specialist. You're wasting his time also, and you're wasting your physical time and financial strain also. Wasting everything. So we need to, and this has come because we have remained in our clinics most of the time and not educated people about it. So this comes as the primary health care has to be there, and secondary care has to have a gatekeeping. And beyond secondary care, against super specialist tertiary care also has to have gatekeeping. That means the whole purpose of the health system is to unburden the secondary care hospitals and tertiary care hospitals. You cannot be proud that your medical college is flooded. Okay? Because you're wasting everybody's time, and you're also compromising many lives, because who deserve the most attention also don't get the same attention. Okay? So unless you do this, you cannot have a public health approach. So this means the pyramid not only narrows in terms of this one, it narrows in terms of the workload, it narrows in terms of the number of facilities. Okay? So you can't turn the pyramid that you have more medical colleges and very less primary health centers. Doesn't make sense at all. This is the other component A. And as I told you, everything has to look at all the 5: preventive, promotive, curative, rehabilitative, and palliative. Now next question, what does it mean? So we need to ensure universality, we need to look at quality, comprehensive, continuum of care, whole of society. Because continuum of care comes only when you want to go from the bottom to the top, because every person has to be screened. If necessary, has to be pushed. We are not denying anybody any service. But we need to ensure a gradual and a legitimate, as per need, movement up. So if you're looking at primary healthcare now, WHO also has started defining it as a whole of society approach. Okay? That means whole of society approach, which has the highest possible health and well-being, equitable in distribution, as early as possible, inclusive of everything that I spoke about, all the 5 parameters, but feasible to people's everyday environment. So you cannot say that I will create a beautiful Alaska facility in Alaska and everybody will travel there. Okay, doesn't make any sense. It has to be feasible in their everyday environment. That means it should be closed. And that is why National Health Policy reiterated the fact that mainstreaming of different health system to pluralism, one thing, 2/3 of our health spending should be on primary care. Okay, and it has to fulfill 8 C's. It should be the first point of contact. It should be comprehensive, that people, you cannot say, I can only manage basic illnesses. The rest, if he's a geriatric problem, he has an hypertension, you go there. You have a mental health problem, you go there. That transport. So everything should be provided. It has to be comprehensive. Those needing continuity of care there. Convergence comes in when others are involved. That means whether it's nutrition, whether it's fitness, whether it's other sort of support systems that you require, converge. Coordinated. Coordinated is an important word I would like to emphasize. What does coordination mean? Coordination comes within the team. What an ASHA does, the multi-purpose worker or ANM should not do. What a multi-purpose worker does, the CHO should not do. The CHO Kochida, a medical officer should not do. But at the same time, they should do it sequentially, serially, so that everybody has a clear division of labor, and they coordinate so that everybody's work output is optimized. Time and efforts are also optimized. They should go back home also on time. Okay. And it should be client-centered, communitization, and cost-free. It is 100% free. Next. So what is the current ecosystem that the Ministry of Health and Family Welfare has actually conceived and has been promoting? So you know, for every 30,000 population, which is in the box, and 20,000 in the, you can see the box on the left side, in the rural area, 30,000 population, you have 1 PHC. In tribal and plain and hilly areas, you have 20,000. Within that, there are sub-centers. The sub-centers are all 5,000 population or 3,000 population. This forms a big ecosystem. The primary health center medical officer becomes the pivot. He is the leader who has to mentor and monitor the sub-center CHOs. So the CHOs are a trusted lieutenant of a medical officer. Okay. Why trusted lieutenant? They are guided, they are mentored, they are monitored. At the same time, they're responsible for the 5,000 or 3,000 population that they have this one, because we are now talking about health outcomes of the population and not cures of one person who comes. No, that's why I said CHO. No. CHO is the mid-level healthcare provider. Okay. Only in Ayush Health and Wellness Center, you call them CHO only, but you are actually giving a medical officer post. Whereas this one, in fact, nationally, if I want to give you the figures over there, out of 1,22,000 mid-level healthcare providers, 1,05,000 are nursing officers. Okay. Similarly, in urban areas, now a new urban health and wellness center has come. This is completely allopathic system. I'm not going to name. And this allopathic system will have 2 lakh health and wellness centers in the country by 2024. Okay. Whereas the entire Ayush system, including hospitals and dispensary, are 27,000. Okay. So, next. So, a CHO has 3 roles. There are clinical roles, there is public health role, there is a managerial role. So, you need to equip the CHO to ensure that all 3 roles are performed by the person. So there is a debate whether she has to go to the field, he or guy has to go to the field or not. Definitely has to go to the field. But when and how, we need to organize it. Next. So there is both a facility-based action that they have to do. There is a community-based action that they have to do. The facility-based action is more to do with their clinical work over there. That they have a stipulated time you can define to do it. It can also be clear days. On one day, they should be on field only. So, as per our guidelines in the Ministry of Health and Family Welfare, every Friday she has to be out. Okay. Friday is a field day. So, in community based, there are a lot of activities that he has to engage in. Then the other important element when you're talking about clinical care at the population based level. Next. So, you're talking about all the 12 package of services. So, anybody from, it is basically, why did that 12 come? Womb to tomb. That's all. Okay. From birth to death, all services are involved. It is also head to toe, from bottom to top, everything is covered. Okay. Whether you have got mental illness or an eye care problem or an oral problem or you have a trauma, everything is taken care of. Okay? But what you have to appreciate is it is not about prescription writing alone. It's a population. In fact, I just want to appreciate this point through one of the anecdotes that I actually physically. I had been to Nadia district, which is an aspirational district in West Bengal. Okay. Nodia. So when I went there, I just went to a CHO. The CHO was actually traveling 2.5 hours one way to reach that place. She's a staff nurse who was a staff nurse for 2 years before she got employed this one. I asked her only one question. Okay. Saying that how many hypertensive patients are there? This is all I asked. You know what she answered? She said, I have 81 patients, sir. Out of that, 65 patients last month, they came by themselves. 16 patients के पीछे मैं पढ़ना पड़ा, मैं आशा को बोलना पड़ा. And this was in the month of August. And I was visiting her around 26th, 27th. And she said, इस महीने 11 और पेशेंट आ गया, डिटेक्ट हो गया. I can 100% tell you, even I will not be able to think like that. Now you know how much she has owned up the community. She says 85 patients, 65 came, 16 have not come. I've sent my ashas to follow it up with them, and I've got 11 more patients detected this time. That means she's taking it. Okay? And I asked her a specific question saying that 5 घंटा ट्रैवल करते हो, इतना सारे मेहनत करते हो, इतना पूरा कम्युनिटी को पकड़ में रखा है. What motivates you? You know what she said? She's a staff nurse, so naturally, सर मेरे को बहुत खुशी लगता है. क्या खुशी थी? पहले मैं अस्पताल में था, डॉक्टर साहब देखता था, मेरे पास भेजता था. अभी मैं देखता हूँ, डॉक्टर साहब के पास भेजता. So you have to understand the dynamics. They have become very vibrant. They are actually the force to reckon with. And this is the best time where there is political will, there is a policy push, there is a financial, this one. If you don't strengthen primary health care, we have no other time to actually this one. This is the best opportunity that we have got. So now that is what I expect even the Ayush CHOs to be doing. Even for a Panchakarma, you have 14 days to therapy if you have. How many people do you follow up? Where do you keep track of those people? When do you do it? Aaya nahi, main kya karu? This is not the ownership. So this is the context that I'm trying to. If she is able to follow up 81 patients clearly, so why can't this one? And this is the population-based approach that we are talking about, how public health actually functions. So the whole purpose is not about detecting people or prescribing drugs for the people. It is ensuring that so many people have control of blood pressure and so many heart attacks and strokes have been stopped and people live 10 years longer. If all of us can make a mission saying that because of our efforts, we can ensure India's life expectancy go up by 10 years, what more pride you can have even on the deathbed? It is the most contented life that anybody could look at. Can you look at your CHOs to challenge them to do this? Next. Of course, illness and wellness, this is a big paradigm. And I need not be taught about it because Swasthasya Swasthya Rakshanam was your first slogan. So you need to look at that element. So in our case, there are many other elements that have been added, Eat Right campaign. This one, Eat Right is a common slogan for you because without Patya, nothing happens. Okay. Next. The other thing is technology. I think I was very happy to hear Dr. Bhagnesh talking about e-Sanjeevani being integrated. In fact, this has been a discussion between the two ministries. And Madam has been personally involved now. I said e-Sanjeevani should be there for every facility, irrespective of Ayush or allopathy. Because the only difference that we have actually advocated is for an allopathic sub-center, health and wellness center, it will be only a spoke. A PHC will be a hub cum spoke. And for district hospitals or community health centers in some places and medical colleges will only be hubs. But in case of Ayush HWCs, we have said let it be hub and spoke, hub cum spoke. The reason is for all the sub-centers, which has only allopathy, Ayush Health and Wellness Center should be acting like a hub for Ayush services if they want. And the advantage of e-Sanjeevani versus other facilities which I've seen, even in Madhya Pradesh, you have a challenge on that. The issue is the prescription comes on print, so there is no confusion, no laws broken. If an Ayush practitioner sitting there has given the prescription and my CHO is only distributing the drug, we have no challenge. And I urge the Ayush Health Ministry to ensure that the list of drugs that has to be kept in the sub-centers to be created, shared with the ministry. The second thing that we also have an orientation to our CHOs only for dispensing purpose. Okay, that could be looked at, then you can see people have choices. And that is the same thing, leveraging technology today. And India today has got more, in fact, we have already finished close to 11 crore teleconsultations. Okay, that's India's figures. Next. So the continuum of care, this is other thing which Ayush also has to look at if you want to have a public health approach. 70% of your problems, there's one rider that I would like to say coming from Ministry of Health and Family Welfare. I want to tell the Ministry of Ayush. I'd been very recently to Goa. So when I saw madams in this one suddenly because there was a G20 work there and we also had the 45 countries delegates visiting our health and wellness centers there. One challenge that we have is you have an Ayush IT system. Beautiful. But at the primary health care, when you're talking about pluralistic choice, you cannot have two registration systems, two entry systems separately, because by that we are actually dividing and discriminating straight away. At that level, when the person comes for a registration at the primary healthcare level, we want that to be integrated into the regular ABHWC portal framework. Because otherwise it doesn't make sense. At the higher level of district hospital or medical colleges, you please there. So what I'm only saying is true to the pyramid. In the pyramid bottom, everybody gets everything at one place. But as they go up, if they go to an Ayurvedic hospital, they can get referred to Ayurvedic hospital, let the Ayurvedic hospital see this one. And we have already talked about ABA IDs. ABA IDs should be mandatory even in your health and wellness centers, because that will be the bridging block or a bridge between all, I would say, various IT portals today we are talking about. Because IT portals, by no other means it can be bridged, because each of the IT portal is genuine, was very much necessary, and were done with the best of the technology when it was developed. RCH was developed 20 years back. That time, that was the best technology. Nikshay was developed 10 years back. That was the best technology. ABHWC portal is created only 2 years back. That is the best of the technology. So, but the technology changes, and we can't repopulate 140 crore population over there. The best way is have an ABA ID, everything starts pooling in then, and that becomes the bridging block. So Ayush also should take, in which case, when the primary healthcare, wherever the patient comes, the patient is unique. He wants to go to Ayurveda, he can go to Ayurveda. So the primary healthcare level, there should not be separate registration, whether it's a co-located PHC or in terms of a sub-center. You can always allow the computers to do more analysis and throw you reports to say that how many Ayush people access the Ayush services. That is not a problem today. Okay. What is continuum of service? What should happen at the community level, like population enumeration, outreach services, community-based risk assessment, awareness generation, and counseling? I'm very happy that I saw from Karnataka, even feedback has been done by at the Ayush Health and Wellness Centers. And then at the sub-centers and PHCs, you could have the first level of care in this month. Then at the primary health center, the diagnosis and drug prescription, advanced diagnosis. The most important component of continuum of care is the next, this one, that till date when we talked about referral, it was only going up. We don't know where the patient reaches. We send them up also. Okay. We need to ensure that we follow up at home also. That means, this is the, please press the button. So you can know, next. So follow up. So even if it is a medical college, they should be referred back to the home. At the same time, the ABA ID should get tracked to the nearest this one. And we find a very valuable input, because what happens is the moment the patient goes back home, our ASHAs are able to follow it up. Okay, they can get physiotherapy locally if they need. They can get drug refill locally. They can get dressings locally, or even a suture removal, or a counseling. At the same time, our ASHA functionaries and the primary healthcare system can remind them to go to the specialist on the specific day. So in that context, your own, that is what a public health is about. That is about population-based approach. You're owning the person, whether he's been referred up. When he comes back, we still follow up. We don't give him up. We only track the patient all through. So this upward come downward referral has to be looked at when you're talking about continuum of care. Next. ABA ID, Dr. Bhagnesh has already suggested, and this is again, we are only reiterating that this should be there. Next. Wellness, I will not talk because you are best experts about it. Next. The other thing, if you want communitization, this is something that Ayush Ministry has to look at. I've been recently on a CRM visit just before Madam took over, I think. Actually, I visited the Siddhi and Singroli Ayush centers also, Ayush Health and Wellness centers also. And I saw that there is no community level engagement. So I think we need to ensure that the Janarogya Samitis that were created for allopathy PHCs and sub-centers are applicable even for Ayush HWC. Only then the people will start engaging with the facility, owning up the facility, accountability of the facility will also increase, ownership of the facility and utilization will also go up. And people will get to know more about what is happening on the service side so that they will be more easy to access those facilities also. So there are already existing frameworks. Village Health and Sanitation and Nutrition Committee is existing. 550,000 such VHSNCs are already registered on Ministry's portal. Then we have Janarogya Samitis at all sub-centers and PHCs in allopathy, but I would appreciate this could be integrated into the Ayush system also there. And the guidelines can be the same because it's already existing. It's all available on public domain from the National Health System Resource Center portal. Next. And what does it actually mean in terms of communitization? It is basically ensuring all stakeholders are involved. If I look at the Janarogya Samitis, there are only 4 types of stakeholders. One, elected representative, who is the chair. Government functionaries, who are basically, health department will become member secretary. The rest of them will be members. It could be a teacher, it could be an Anganwadi worker, it could be a waterman this month, or a youth affairs this month. Third is community representatives. It could be self-help group members or Yuvak Mandals. So that is the general community. That is the third category. And the fourth category is a user community. Take 2 representatives who have been regularly using your services. They'll give you better feedback of what exactly happens. These are the 4 categories that are required in any Janarogya Samiti. Similarly, if you are looking at VHSNC, we already have those 3 categories. User community is not there because it is not, there is no facility to use there. It is in the community. So VHSNCs are in the community, which takes care of socio-cultural, environmental issues to be targeted, whereas the Janarogya Samiti has a direct oversight on it. Last, next. RKS, see, there is a clear differentiation. RKS is from community health center upwards. The reason is a very symbolic change. RKS in PHC has been renamed as Janarogya Samiti because we no longer interested in a small segment of Rogis. We want the entire Jan to be taken care of. That is why it's called Janarogya and not Rogi Kalyan. Next. And intersectoral. And there are already modules existing for even training them. So you can actually look at now National Health System, National Institute of Rural Development and Panchayat Raj is also involved. There are training modules available there. Next. Finally, what are we looking at? This is the health system that I spoke in the first. But what we are trying to look at over a period of time is such sort of holistic approach where within a portfolio of 30,000 population, at least there are 2 Ayush Health and Wellness centers and 1 PHC which has got a co-located Ayush center. At the same time, the balance sub-centers will remain. And you could see there is clear cross-referrals. At the same time, teleconsultation links so that people reaching out to any center gets all types of services. And this is the level that we should evolve in the country if people have to have a pluralistic approach. At the same time, there is no dilution of laws or competencies in terms of delivery of service. So I hope we will have this sort of holistic health system approach as we move forward with greater collaboration between the 2 ministries at the national level and between the 2 departments at the state level. Thank you very much. This is the last statement that I've made. We need to bring public to the public health and then to the public health facility. Otherwise, we will not have public health. Yeah, I think this is a narrative that has emerged from the very educated groups like us. Reality, what I would like to say. I have studied up to anesthesia. That means there are a lot of subjects I studied. Doesn't mean when I see a patient, I'm going to do it segment-wise. It is only one patient for me. No, let me clarify to you. The population norms of ASHA has never changed. Even today, okay, I have visited 28 states in the last 2 years, okay? And if I want to tell you, I've interacted with ASHAs at every place because my journey, in fact, my ASMD used to tell me, you do a CRM every time you go. Because everywhere I go, I first go to the village, then go to the sub-center, then go to PHC, then go to district hospital, then go to medical college, then meet the mission director, and sometimes along with the mission director or without the mission director, I go and meet the principal secretary and come. Every time it is the same routine for me for every state I go. What we have to appreciate is ASHA has been handling 150 to 200 households all her life. There is no change. Even today, she visits 150 households. Previously, what used to happen was the fact that she was able to see only if there is a pregnant mother, if there is an immunizable child. So our revenues were also limited to that. Today, if she knocks the door, she gets money. If she gets it, and the number of visits the ASHAs does will not be changed. And I can give you Nayagarh district of Orissa. When I visited, I asked the ASHA, what difference has it made to this one? In fact, she told me, Abhi to my har ghar ko tokne se kuch mil jata hai, sir. This is the statement. Then I said, how are you feeling? She said, when did you join? She joined in 2011. I asked her, us samay aur is samay ka kya farak pada hai? Sir, aur kya bolo, sir? When I joined as ASHA, nobody was interested in my village to become an ASHA. Okay? आज अगर आशा का advertisement निकलता है, 50 लोग apply कर लेता है, sir. That means to say, her pride was only with it. In fact, she told me this statement, saying that is the pride that we have today. And I said, why do you work so much? She said, itna izzat milta hai, itna samman milta hai community mein. So I think, let me clarify to you, today, if she really, this one, do you know how much the ASHA can earn out of Government of India's PIP? 12,000 rupees. If she performs a role. And that is why the simplification process. No, I agree with you with respect to your experience, but I'm also quoting that there is a parallel experience that is also there.
I still remember Union Health Secretary Mr. Mishra was there. He had brainstorming on this that we should have a male ASHA also so that the workload will be decreased. You may not agree.
No. Male is required only because we have mental health, palliative care and other things which is coming up in a different dimension. That is one different debate altogether. But what I would only want to clarify to you is, ASHAs are not getting money not because of the norms. ASHAs are not getting money because of the procedures that have been created with respect. In fact, I'll tell you, I came even in Pune, periphery, when I visited, 40-page booklet is what she submits every month for her claims. Utna barna padta hai because 2 rupaye, 5 rupaye, 1 rupaye, and for everything. And the moment you put rupaye, our administration will say that I have district accounts manager. And I'll tell you how much it takes. That's why we have actually the new norms are telling that the recommendation and approval should be at the CHO level for this one, and the finance can simply pass the bill immediately. Now what is happening? You're pooling all the things. Actually, a taluk will have at least 200 ASHAs, and the whole district will have not less than 1,500 ASHAs. Everybody's payment goes to the district accounts manager, and that person takes his own 40 booklets into 1,500. When will he verify? And what does he verify? I still am not convinced that it is going to be verified, because there is no way that he can verify 1,500 people's 40-page booklet, and ultimately some random check happens, but she will not be able to even track for which she has claimed whether she has got the reimbursement or not. So this is being simplified. Probably in a month from now, you will get the announcement with respect to the simplified scoring system. Thank you. Yeah, yeah.
Since the beginning of the implementation of now, we have talked about the convergence and the mainstreaming of Ayush. And we are like in the IPHS norms 2012, under the PHC, the Ayush doctors are under desirable category, and under CHC and the district hospital, they are under the essential category. But the IPHS norms 2022 have come up, and in that IPHS norms 2022, the Ayush doctors, they are all under the desirable category now. So can you please enlighten us with that? Why is it that so? Because after talking about convergence and being like mainstreaming of Ayush and co-allocation of Ayush in the allopathy hospitals also. And one more question is about the ASHAs. Like in our Ayush HWC, the orientation guidelines, the maximum number of ASHAs that we can put up is 5 numbers of ASHAs. But in the very remote areas, in HWCs, I'm talking about HWCs now, but in very remote areas in our state, where one HWC is looking after like around 14 villages. So in each villages, they'll be having one ASHA each. So for the, like giving their incentives, like if the maximum cutoff is 5, what will the rest of the ASHAs, what we will give them, that's what we are thinking about.
I would like to clarify on both the accounts. The first account I'll tell you about ASHA. ASHAs are not tied up to the health and wellness center. ASHAs are actually selected by the community in the Gram Sabha based on population norms. So how does it affect which health and wellness center, where it exists? Because it's a population norms that are defined, and states like Northeast, Arunachal Pradesh has got 150 people ke liye ASHAs. I know. I've been to Namsai district also for that, this one. So if you are looking at there, ASHAs are based on population norms, not selected by the health department. It is selected by the Grama Sabha. Health department is only a facilitator for it. Okay? So the Gram Sabha has to be created. So if your choice of selection is, process of selection is correct, every village, in fact the norms also for hilly tribal areas, it says that even for habitation you can select one. So it is the state's decision how many you selected or not selected. This is one. The second thing that I want to say is essential and desirable. Basically what it means is giving you flexibility to get IPHS certified. That's all it means. Basically what we are trying to say, if I make it essential and the state is not able to recruit or find, you will never get IPHS certified. While in the same conditionality norms under the National Health Mission, we have said that every state has to achieve 50% IPHS certification by 2026. And if we put very rigid norms on these things, then automatically states will not be there. So it is more an enabler and not a preventer of any this one. The very fact that it is there in desirable means you still have an option to please and nobody is preventing you from doing it. The reason why it is not made essential is it is supporting the state, saying that if you want to achieve IPHS standards, please achieve comfortably. For me, I would like to look at it in a different dimension. What is duplication? Because the citizen that you serve is the same. So, is the citizen duplicated? No. If the committee of VHSNC is there, when you, what does VHSNC do? VHSNC looks at the community. It is not your health and wellness center. It doesn't look at you as a provider. Basically, VHSNC is supposed to ensure that the patient's social, environmental and cultural determinants which are affecting that person's health is supported for at the community platform. If you have a principle to educate them, go and educate them. VHSNC doesn't listen. It's like in this platform, All of you are there. We are all from different states. We are all holding different portfolios. All of us came and all of us are talking to you. So that is not a duplication of careers. So don't say that VHSNC has to be owned by. VHSNC is a community asset. As you know. So community platform, anybody can go and engage with the community platform.
But what about RKS and JAS? They are also constituting RKS at Ayush Health and Wellness Center level, and they are also constituted at Health and Wellness Center level.
There is no, see, there also there is no problem. Okay. Our minister holds two portfolios. He is a minister of cabinet minister for pharmaceuticals and fertilizers also, for health and family welfare also. As an elected representative, as a community, how many public health assets are there? They can own everything. Because JAS overall role is oversight of a functioning of a health facility. So who else should own? It is the community. So the community can own every asset. The same community member will be in the school development committee also. Same person will be also in the Jana Jagrati committee in the ration shop also. They will also be in the same elected representative will also be there in the selection of Awas Yojana also. So it doesn't matter. So let us understand the fact that Jana Arogya Samiti is not created for you to own. Jana Arogya Samiti is created for community to own your asset. Okay, and that is what the communitization process is all about. Thank you.
So after a long very good, deep insights into the entire process of the community process, as well as the comprehensive primary health center. What is supposed to be achieved by the Ayush HWCs has been deeply dealt by advisor NHSRC. So I think some of the one or two issues that what he flagged, particularly the Ayush medicines in all the health and wellness centers in the country, because even the Ayush HWC medicine, whatever we have suggested that 36 and 14 single ingredients and 36 formulations, the same thing. I think there won't be much problem to adopt that in the entire HWCs. That is one thing. Similarly, what is the role of the ASHAs and how the ASHAs can be linked? Actually, there is a MOU already signed by the states, both the health department and the Ayush departments in all the states. So there won't be much problem to engage them. Only the enabling guidelines has to be percolated to the down the line. Then it can be easily possible. So thank you all for participating. This is very good, lively discussion also happened actually. So I thank on behalf of Ministry of Ayush all the eminent speakers on this particular session actually. So this type of process has to be completed and continued in the future also. So that kind of orientation and reorientation of our health workforce will definitely give some more and more deep insights into the system, how it works and how it deliver in the actually in the community level. In that way, I think we can go ahead. So for as a token appreciation, I invite Dr. Suresh Kumar to give the memento to learned speakers. Advisor CPHRC, Dr. Balasubramaniam. Yes. Dr. Bhuvanesh, Jharkhand. Yeah. Sri Manjunath, Commissioner Secretary, Karnataka. Madam Secretary, Commissioner, Madhya Pradesh. So, thank you all the listeners. Thank you. Tomorrow, even though today we are late, so tomorrow we need not be late. Exactly at 9 o'clock we have to start. So all the state representatives, everybody has to come at exactly 9 o'clock. Thank you.